Hi parents. If you're anything like me, this is probably how you're feeling right about now. Stuck, wanting to get out, looking at the world from the inside out. I know I'm ready. How about you? I know the first couple of weeks were okay, being at home, not a big deal, easy to adjust, but it's been a while now, and most of us were ready to get back to life as it used to be before the coronavirus. Hi, I'm Dr. Rosado. I'm a child psychologist, and I would like to ask you for just a few minutes of your time today to talk about, you guessed it, the coronavirus. Unlike anything else we have seen in our lifetime, the coronavirus has impacted just about every human being on the face of the earth, and that includes our children. So, how should we expect our children to respond? You have probably already gotten plenty of complaints from your kids about being bored, right? That's probably the most common reaction to staying at home. But there are a few other changes that we should be on the lookout for in our children. For instance, younger children, they may start feeling afraid when they're alone, or they may even start having bad dreams at night or wetting the bed in some instances. Younger children could also appear cranky or may even start to have temper tantrums more often than usual. School-age children may also become easily upset or angry, and sometimes for no apparent reason. They may also have occasional bad dreams or may want to be near their parents more often than usual. Another common reaction among school-age children is having trouble concentrating, which can be concerning right now with online learning. Let's talk about teenagers. Although teenagers are a little bit older and may be better able to understand what is happening, they can also be affected by what's going on. Changes in sleep or changes in eating are most common at this age. You may also see that they argue more often, or they just plain and simple want to be left alone. Oh, and parenting a child with an existing healthcare need, that could be especially stressful during a disease outbreak, both for the parent and for the child. So, how do we help children cope? I'd like to share 7 things that you can do to help your child. Number 1, remain calm and reassuring. Focus on helping your child feel safe. Answer their questions and listen for anything that they may have misunderstood about what's happening and give them accurate information. Sometimes it could be hard to explain complicated things like the coronavirus to young children, so check out resources that can help. For example, there's a storybook called The Germ That Wears a Crown. It's a story that explains to children what is the coronavirus, how they may have some uncomfortable feelings about it, and what they can do to help. You can get the book online at www.fsustress.org. Number 2, keep as many everyday routines as possible. Try to stay consistent with bedtimes, meals, chores, exercise, and schoolwork. I know that's kind of hard right now. Our schedules are off, we're getting up later, we're going to bed later, and it's hard to keep a routine. But as much as possible, try to have a daily schedule and stick to it. Number 3, help children feel in control. Ask for their help about ideas of what you can do as a family to stay healthy and to stay safe. You may even want to make a little bit of fun out of it and do things like thinking up of germ busters, little things that kids can do to get rid of germs, like washing their hands, or covering their mouth when they're coughing or sneezing into a tissue or elbow. Number 4, help your child feel connected to others. Stay in touch with friends and family on the phone and online. That's really important right now when we can't get out and see the people that we're used to spending time with. If you're stuck at home, try to make the best of it and do family things together. Get the old board games out, teach your children some card tricks, but try to have fun as a family as much as possible. Number 5, allow your child to talk about feelings and worries if they want to. They could talk, write, or draw about how they're feeling. Check in with your kids on a regular basis or when things change around you. You may need to help your child put some feelings into words. So say something like, "A lot's been happening lately. Is there anything you're wondering about, or is there anything that worries you? And if you find that your child isn't saying much, maybe find other ways to share. For instance, you can ask your child to draw a picture about how they're feeling and then explain the picture to you. Number 6, make time every day for stress-reducing activities. Help your child create a habit with calming, stress-reducing activities that they can do, like exercising, taking deep breaths, or you may even want to look up some YouTube videos about yoga and relaxation, but deal with the stress. And then number 7, take time to deal with your own feelings. It's harder to help your child when you are really stressed or worried yourself. Talk it out with other adults. Get some support if you need it, but you also need to be relaxed. Remember, everyone's reaction might be different. Every child has a different response to what's happening, so check in periodically and not just once. If your child's worries or behavior changes are getting worse, or if you're starting to get concerned about it, talk to your child's doctor about the best way to help. There may be online or phone-based services and appointments that they're offering right now to help support your child. Hopefully soon we'll be talking about something other than the coronavirus. But until then, remember, if we are stressed out, chances are that our kids are probably feeling the impact too. So let's do what we can to help ourselves and to help our children cope. For more information, please visit www.fsustress.org.